Hi guys, in this video we're going to talk about calcium deficiencies. Now, I put a link down below so you can see calcium excesses as well because so many people have too much calcium. It's locking up the soft tissues and creating all sorts of issues. So watch that one too. But if you're deficient in calcium, these are the symptoms. Number one, insomnia, specifically early morning insomnia. Let's say you get up an hour before the alarm clock, boom, you need some calcium. So calcium will allow you to go a little bit longer, and that's because calcium is needed to make tryptophan to make melatonin. So it's not just about calcium in the muscle itself relaxing you, it's about your hormones, okay? Muscle cramps, okay, so that's one common symptom. So I recommend calcium lactate or calcium citrate. It's very easy to find. Brittle nails, tooth decay, bone loss, and red-purple spots. They could be really small or they can be bigger. Why? Because calcium is involved in the clotting of blood, just like vitamin K is. Okay, then tetany, that's a little twitching right through in here. But many times it's not the calcium, it's you're too alkaline and you're not able to transport the calcium and it becomes unavailable to you. So you get these little twitches, different parts of your body. It's called tetany. There's more symptoms, but these are the main ones. Pins and needle around the mouth and the lips or on your hands and your feet, which could also be a diabetic symptom as well. So they can mimic each other. Okay, now what are the causes? Hypoparathyroidism. Now, not hypothyroidism, it's the parathyroid. There's four little glands behind the thyroid. They're really tiny, and they're like the size of a seed of a rice, a grain of rice. And when it's low, it can actually affect the calcium. When it's high, it raises calcium and it'll steal it from the bone. Kidney damage can cause a calcium deficiency. Calcium channel blockers, that's what you would take if you have high blood pressure because that blocks calcium. Antacids, which dry up all the acid in your stomach, giving you low stomach acids. You need a really acidic stomach to absorb minerals, specifically calcium. So that could be, why you're deficient. Vomiting or diarrhea because you're losing fluids. Excessive magnesium. So let's say you're taking the remedy called Calm, which is magnesium, and you're taking it, but you're not adding the calcium in there. That can create an imbalance because calcium and magnesium work together. Then we have low vitamin D, right? Let's say, for example, it's not in your diet, or you're not getting the sun, or your gallbladder is missing, or you don't have enough bile because your gallbladder's congested, you can't absorb the fat-soluble vitamins. So that's another common reason. Low stomach acids, and then alkalosis, which basically your pH of your blood is just overly too alkaline, and that can come from adrenal stress and high cortisol, okay? The best foods for calcium would be grass-fed dairy, cheese. I do a lot of cheese. You get a lot of calcium from that. Greens, leafy greens, spinach, bok choy, kale is loaded with calcium, nuts, seeds, fish, sardines, and it's in a lot of other foods as well. If you're going to take a supplement, I would go for the calcium lactate. If you can't find that, go with the citrate, calcium citrate, but do not go for the calcium carbonate. That's like chewing on cement. It's just chewing on this wall right here. It's just not going to be absorbed too well. It's like chewing on rocks, all right? So share your comments below. Thanks for watching. Where am I going with this? Press the subscribe button. Forgot the last part. And I'm going to see you next time. I will press the subscribe button and I will keep you updated on the future events.